Hello and welcome to this informative video on the 13 signs that you might be eating too much salt. Salt is a crucial ingredient in many of our favorite dishes, but consuming too much of it can lead to serious health problems. In fact, the average person consumes way more salt than their body needs, which can put them at risk of developing high blood pressure, heart disease, and stroke. So, if you're someone who loves to add salt to your meals or indulge in salty snacks, this video is definitely for you. By the end of this video, you'll learn about the 13 telltale signs that you might be eating too much salt, and most importantly, how to cut back on your sodium intake to lead a healthier lifestyle. So sit back, relax, and let's dive into the world of salt. Number 1. Bloating. Bloating is a sensation that can be caused by many factors, and one of the most common short-term causes is excessive salt intake. Salt, or sodium chloride, is an essential mineral that the body needs to function properly, but consuming too much can lead to water retention, which can cause the stomach to feel swollen or tight. This happens because salt helps the body retain water, so excess fluid builds up, and this can cause bloating. It's important to note that not all foods that are high in sodium taste salty. In fact, many processed and packaged foods such as sandwiches, pizza, bagels, and canned soup are sneaky sources of salt. These foods can be high in sodium without tasting salty, and it's important to read food labels to identify the sodium content of the food you eat. Number 2. High blood pressure. One of the leading causes of high blood pressure is excessive sodium intake. Your kidneys play a crucial role in regulating blood pressure, and a high salt diet can impair their ability to eliminate excess fluid. This can result in fluid buildup and a subsequent increase in blood pressure. Keeping your salt intake under 5 grams per day can help reduce your risk of high blood pressure, cardiovascular disease, stroke, and coronary heart attack. Number 3. Unexplained increase in thirst. Feeling extremely thirsty can be a telltale sign that you're consuming too much salt. When your salt intake is high, your body becomes dehydrated as it pulls water from your cells. This can lead to an intense feeling of thirst. Drinking water can help counteract the effects of excess salt and keep your body properly hydrated. Please subscribe to our channel so that you can be notified when we release a new video on how to stay healthy. Number 4. Weight gain. If you're experiencing sudden weight gain, especially if you have a history of kidney or heart disease, excessive salt intake could be to blame. Retaining water due to excess salt consumption can lead to weight gain. If you notice a weight gain of more than 2 pounds in a day or 4 pounds in a week, it's worth assessing your recent diet and making changes to reduce your salt intake. Number 5. Frequent urination. Drinking too much water isn't the only thing that can cause frequent urination. Surprisingly, consuming high amounts of salt can have a similar effect. Your kidneys have to work overtime to remove the excess sodium, which can result in more frequent urination. Number 6. Poor sleep. Eating too much salt before bedtime can disrupt your sleep patterns. This can range from having restless sleep to waking up frequently during the night to feeling unrested in the morning. It's important to be mindful of your salt intake, especially in the evening. Number 7. Weakness. An excessive salt in your bloodstream can cause water to leave your cells to balance out the sodium levels. As a result, you may start to feel weaker than usual. It's important to keep your salt intake within healthy limits to maintain optimal bodily function. Please subscribe to our channel so that you can be notified when we release a new video on how to stay healthy. Now let's go to the long-term effects of excessive salt intake. Consuming too much salt over a prolonged period can increase the likelihood of several health problems, including Number 8. Enlarged heart muscle. Excessive sodium intake can cause fluid retention and increased blood pressure, leading to the enlargement of the heart muscle. It's important to be mindful of your salt intake to avoid this potentially serious health problem. Number 9. Headaches. Some studies have found a link between high salt intake and headaches. Consuming meals with high sodium content can trigger longer and more severe headaches. More research is needed to establish a definitive causal relationship. Number 10. Kidney disease and kidney stones. A high sodium diet can trigger kidney stones by increasing the amount of calcium in your urine. If you're prone to kidney stones, a low sodium diet is recommended. Number 11. Osteoporosis. Excess salt can lead to bone weakening and increase the risk of osteoporosis. High blood pressure caused by a high salt diet can also accelerate the rate at which calcium is lost from the bones. Number 12. Stomach cancer. Studies have shown that excess salt damages the stomach lining, causing lesions that can eventually lead to stomach cancer. It's worth noting that infection with Helicobacter pylori bacteria can also damage the stomach lining, and this damage can be exacerbated by salt consumption. Number 13. Stroke. Eating a high salt diet can increase the amount of blood in your arteries, raising blood pressure and increasing the risk of heart disease and stroke. Please note that knowledge is advancing by the day and we will like to always post an update about this. Thanks for watching. Please subscribe to our channel to know when we post a new video on how to stay healthy. You are watching Zoom Hospital channel and listening to work of Dr. Kayode. Thanks for watching.